welcome Billy Rios to this S4 deep dive. Welcome, Billy.
Yeah, thanks. Thanks, everyone. The obligatory sheep slide for S4 presentation. I'm running a little bit behind, so I'm just going to get to it here. There's a slide about the company, but the first thing we want to talk about actually is what an infusion pump is, because there's some confusion actually to what it is. It's actually not an implantable device. An infusion pump is actually a device that controls the amount of medication that's given to you through an IV. So if you're in a hospital bed and you have an IV hooked up to you, it's more than likely that instead of a nurse sitting there kind of giving you doses every once in a while through a needle, they're probably actually going to put the drug in an infusion pump. And the infusion pump is actually going to control the amount of medication you get over a course of time. So that's what an infusion pump is. And then obviously the next question is, how do they work? And that's kind of the heart of this talk here. So we'll talk a little bit about vulnerabilities, but more importantly, we're going to talk about how these things work. And so we have 3 different infusion pumps that we're going to show you the guts of, the internals of them. And then if you have any questions towards the end, you can definitely ask the questions. But more importantly, if you actually want to play around with the infusion pump, you can actually just come to the entrance area where we have the 3 pumps. One of them is already taken apart, but if you want to take one apart, you're more than welcome to do that. So and see what the inside looks like. I even have some JTAG readers and things like that that you can use if you want to hook up to the JTAG and kind of see what's going on in the pump from the software perspective. So I do want to also say this, everyone gets sick. I was sick last year. I was actually in the hospital for a couple weeks. It was for some reason, I'm prone to getting put in the hospital for various reasons. When I went to the hospital last year, I realized that I had been in the hospital 4 times that required overnight stay, and 2 of those times actually required me to stay longer than a week. So for some reason, I'm prone to hurting myself. But the reality is that everyone gets sick, right? And so at some point in time, we all have to deal with these devices in some way or another. So I kind of have a stash of infusion pumps that I own. So some of these I brought, some of them I didn't. Like I said, you're welcome to play around with the ones that I brought here. Some of the stuff that we talked about is covered in advisories. Sometimes the advisories can be a little vague, so maybe we can shed some light on them. But the stuff that we're talking about here is generally publicly known. So about the pumps themselves. So this is the first pump that we're going to look at. It's called the PCA. There's actually a cousin to this pump as well called the PCA 3 made by Hospira. And this is what it looks like. So, and I have this pump in the entranceway if you want to play around with it. The first thing we probably want to talk about is there's a key to unlock the door, and that is needed in order to get access to the drugs. In fact, the pump won't start unless you actually open the door. So, and that is the key. And it actually works for all the PCAs. So if you get that key once, it works for the PCA, PCA 3, and probably any other future version of the LifeCare PCA that's going to be made by this manufacturer. So you just turn it in, you can open it up. I also want to talk a little bit about the architecture here. So I know that this slide is kind of hard to read, but there's actually one really important piece that's pretty well demonstrated by this slide, even if you can't read the text. And that piece is there's actually some separation here. So when we look at this top piece right here, this top box, that is actually where most of the interaction from remote interaction comes from. When I say remote interaction, I'm not only talking about network interaction, but I'm also talking about patient-controlled interaction. So if they're pushing a button on a switch to get more drugs, patient-controlled delivery, they do that through this top piece right here. And then what happens is that kind of gets pushed to here, which actually does most of the real processing. If you look really closely, you'll see that there is an Ethernet connection up here that gets pushed down to this area right here. And then there's also a Wi-Fi module right here that gets pushed to this processor right there as well. So very important thing to understand if you're doing threat modeling or if you're trying to attack one of these pumps. Because these interfaces are different and they have different paths, the wired Ethernet connection could actually be different than the wireless, right? So if you're trying something and maybe you're running into roadblocks or you're trying to be comprehensive in your assessment of a device, knowing this type of architecture is important. So, but if we actually look at the pump itself, if you look really closely as well, you'll see that on the actual syringe that has the drugs, there's a barcode, and that's because the device actually has a barcode reader. So I'm not going to get too much into the barcode reader because I found it mainly uninteresting. But if you're doing research on this, you have to figure out ways to kind of bypass some of these things because the device won't work unless these things are present, right? So like for example, the device won't load certain drug libraries and patient delivery profiles unless there's a real drug loaded in there. So you might have to go to the manufacturer's website, take a look at what barcodes are supposed to look like, print them out, and kind of convince the pump that it's doing something that it's supposed to be doing. So when we talked about that separation between the Ethernet connection and the wireless connection, this is actually what it physically looks like. So this board right here is where you would plug in the Ethernet jack if you wanted to connect it to the network. And so when you initially look at the architecture, you might think that this would be a little bit different than having something plugged straight into the communications board, which is up here. But what we quickly realize is that if we look at the actual hardware, it's just really a pass-through. So all these wires that you see right here, those are actually a pass-through from when you plug in an Ethernet cable to push that signal directly to the communications board. So essentially, there almost is no difference between plugging it in wired or wireless. So that kind of takes some testing cases off of our plate. Another important thing is to look up here and see that this is a communications board. There's the Wi-Fi module, there's the antenna, and we'll kind of dive into that piece in here in a second. So the thing that we just showed you to the left of the screen, this board right there is this piece up top here, right? And then this board right here that we see in the architecture, the CE board, is this board over here. And I'll have more screenshots that show you this a little more clearly. So. And then here's just a kind of a blown up version of that. So we see the Ethernet, the wired Ethernet coming straight through to the Ethernet physical, and then we also see a Wi-Fi adapter over here. If you look really closely, there's also JTAG and debug and an RS-232 port that's identified in the architecture as well. So if we look at the communications board, this one's from a little bit of an older version. We actually see that the communications is actually really handled by a USB Wi-Fi adapter, right? And so that can tell us a couple different things. What that kind of tells me, what I infer from that, is that the Wi-Fi connectivity is actually bolted on, right? It's not something that was designed in this pump from the ground up, right? So this was definitely bolted on. That sticker tells us the MAC address and a serial number for the particular Wi-Fi adapter, which could be useful if we're trying to find this on the internet or within a network. So pretty interesting stuff here. If we remove that communications board from the actual pump, this is what it looks like removed. So I've taken it out of the pump. And so we can see the Wi-Fi adapter over there, and here's the processor. It's a system on a chip processor for this. It's an ARM processor. And so this board by itself essentially operates independently of the other pieces of the pump, right? So if you took this board out and powered it up and connected it to Wi-Fi or connected it to a wired Ethernet, it would actually work by itself. Now, it would expect other components to be there, and it will test to see if other components are there, but the reality is it'll power up and run by itself, which means that this thing has its own operating system and it has its own software. So a very important thing to understand. Once again, there's a Wi-Fi module. Looking at the pump itself, so the communications module that we just showed you, that's actually on the left-hand side right here. So what normally goes here is the barcode reader. I've removed that so we can get a better look at the internals of the actual device. And what we see here is actually the main board that controls most of the real pumping functions, right? So that's the communications module, that's the main board. And so when we look at this piece here, what we see is that there's this net ARM processor that's for the communications module, but this is actually only one piece of this. This is only one piece of this pump. So we'll see that this communications module actually communicates over serial to another set of components, right? And so if we think about that, that's actually really good, right? If you were to design a pump from the ground up with security in mind, that's probably what you would want. You would want your communications module, which is going to be the most exposed component of your device, to be essentially isolated from the main board that actually performs the most critical pieces of operations for your device, right? So, and they've actually done that here, which is pretty interesting. Now, the way that they've done that is they separated this communications module basically via a serial port, RS-232, and we'll show you that here in a second. So when we look at how the communications module is connected to the main board, it's connected over serial. It's just a straight RS-232 communications from the communications module to the main board. And if we look at how that looks in real life, you see this gray cable right there. That gray cable is coming off of the communications module and connecting into the main board, right? So that's a really good design. That allows you to basically cut your attack surface by a huge amount, right? So now you don't have to deal with parsing TCP. This thing has a web server inside of it. You don't have to worry about web server attacks. You really just have to worry about what's going from the communications module to the main board itself. And then you only have to worry about what's going back and forth over serial. And so if you're building this from the ground up, that's probably the design that you want. Looking at the way that this was implemented, I don't believe that this was implemented for security reasons. What I believe the reason that this was implemented is because in older versions, there's actually a serial communications with a more primitive communications board that was just talking serial. They didn't have to worry about network connectivity or anything like that. And so essentially what they're doing is instead of replacing the entire pump, they're just replacing the communications module, adding more features to the pump by just updating one module. So. And then comes the biggest, the most dangerous piece of the entire pump. So that is this linear actuator, which actually pushes a plunger up and down on the actual drug to push drugs through an IV, right? And so if you're looking to do, what the government calls effects on a device to make it dispense drugs at a rate that it's not supposed to, ultimately what you have to do is basically turn this thing on. Right? And so if you're looking for ways to do that, I think one of the really effective ways to learning how to do that is to essentially start here and go backwards and say, well, I really want to turn this linear actuator at a time it's not supposed to be turned, and then back up and say, well, how does it turn? It gets 3.3 volts from this main board here. Okay, well, how do I get 3.3 volts to the right interfaces? And so on and so on and so on. So that's why it's very important to understand how these things work. Compromise of this communications module by itself doesn't necessarily mean compromise of the entire pump, which is a good thing, right? Unless you can actually turn that screw, the drug is not going to be dispensed in a rate that you don't want it to be dispensed. Now I've removed some other components so we can take a better look at the main board here. That's what it looks like. There's usually a locking mechanism that's here as well that kind of covers up a lot of different things. And there's a lot of safety mechanisms built into this. So for example, if you don't have everything just right, this thing will beep incessantly. So if you're doing research, it's going to constantly beep at you. Maybe you can just ignore that. I had a friend of mine that was doing research against this pump in a hotel, and his neighbor actually called the fire department because he just kept hearing this beeping all night long while this guy was trying to do some research in his hotel room. But if you cut that speaker, the pump will actually know. And it'll say, hey, there's a malfunction. I'm not going to allow you to actually start up in the correct state unless all the components are there. So if we look at the processor for the main board, that's this chip right here. It's hard to see, but I think the next one is kind of a close-up. It's an Atmel 1891. It's a very common chip. So, and it's very, very common. You can find a lot of data on how these chips work. In fact, the first thing you should do when you encounter a very common chip is look at the data set or the data sheet, right? So if we pull up the data sheet for this particular processor, we see that it has a lot of serial wire debugging, JTAG stuff kind of built into it, right? And that's useful because if we look at the board, right next to it appears to be a set of JTAG pins here for connecting to JTAG. And so now it's just really a matter of doing continuity checks to make sure that you have the right pins to the right part of the processor, which is very easy, right? So just a standard 14-pin JTAG connector if you want to interact with this particular device here. So there's a lot of ways to do JTAG debugging. So you can use OpenOCD. We developed a file that will help you do it for the on-chip debugger. But here's some ways to do this. If you're working enough with Atmel chips, I would suggest getting Atmel Studio, which is pretty expensive, or you can get a free version of the J-Link software. If you just want an all-purpose JTAG debugger, J-Link is pretty good. And if you are not going to be using it for commercial purposes, you can actually get one for like $60. It's like the educational version of the J-Link, which is kind of an all-purpose JTAG debugger. Highly recommended. So, and if you're looking for serial wire debug and JTAG resources, here's some really good resources for that. So these guys are really good. They can tell you a lot about some of the experiences that they've had. I'm always glad when they share stuff like that. So that was the first pump. That was pretty quick. The second one is a different pump. One thing, if you're a healthcare delivery organization, a hospital, if you're going to sell your device, you should probably get all your data off of it. So pretty much every device that I've purchased, the information for the owning hospital has always been on it. So that includes things like Wi-Fi passwords, configurations, where their infusion management stuff's at. Pretty much every single one that I've looked at has some healthcare delivery organization information on it. So you may have to rig some things up in order to get things working the way you want it to, and that sometimes requires some creativity. So here's just an example of me using some, a water bottle and a spike IV to kind of get this pump up and running so I can kind of exercise its full functionality. So if we look at the design for this, it's very similar to what we've seen in the previous pump. So there is some separation between that rear panel where the Ethernet ports are and the Wi-Fi ports are. They connect to the same processor, and basically the communications engine, the communications board, although it looks a little bit different than on here in the architecture from the other pump, is essentially exactly the same. It's using the same processor, and in fact, when you pull the software off of that communications module, it's actually exactly the same. So, and then you have some separation between the communications module and the actual main pump, but this separation isn't as robust as what we saw earlier, right? So what we saw earlier was that there was just one RS-232 cable that connected the communications module to the main pump. In this case, we actually have a Eurocard connector that's connecting the communications module to pump memory, right? So that's probably not as a robust design from a security standpoint, right? So once again, I don't think that architecture was designed because of security. I think it was just they were working with what they had. So if we look at the communications module for this particular pump, it actually works a little bit differently. So this purple strip right here is actually the communications module. And if you take off the right screws, you can actually remove this communications module from the infusion pump itself. And so if we take a look at what's there, we see some striking similarities between this communications module and the communications module that we looked at before. One of the primary differences is instead of having that 10-pin RS-232 cable from the communications module to the main board, we have this Europin or Eurocard connector down here that provides essentially like a backplane to the main board of this pump. So that's the same processor, there's the flash, and there is what appears to be a JTAG interface as well, right? So, so pretty straightforward. The main pump, or the main board for this particular pump is a lot more simple, right? So it's got some FPGAs on there, and there, of course there's the Eurocard connector down here. And then in order to drive the actual actuators that are gonna actually cause the fluid to go through the IV lines, you're gonna be using this interface right here, right? So if you're working backwards and saying, hey, how do I actuate this pump to do something it's not supposed to, you're going to want to know how to trigger this interface here through the communications port, which is going to communicate over this Eurocard connector. Oh, and this last piece right here is power. This is how the pump gets power. So, and then once again, when we look at how this thing works, same ARM processor for the communications engine, Eurocard connector over serial, and then Eurocard connector to the pump memory, right? So pretty important, a little less challenging as far as the amount of hoops that you have to jump through from the last pump that we looked at. So, and then this is the third pump that we have. This one's also on the table outside, so if you want to play around with this one, you can do that as well. So what we see when we look at this architecture is that it's very different. So this is very much compressed, right? So and for folks that work on automotive, you can see that instead of a lot of serial stuff, RS-232, these guys are using CAN bus. And what we see is that a lot of things are actually pushed together as far as the architecture of this particular pump goes. So they have an Ethernet port here, that's their CE. Their CE is connected directly to the user interface control. So their communications module is actually connected to their user interface. And so when we start to work our way backwards, we can start to say, hey, look, here's the pump controller mechanisms, the motors, the sensors, LEDs, the cassettes. That talks over CAN. So if we can get on CAN somehow, we can probably start manipulating this pump controller. And then one of the ways to get onto the CAN is by taking over the user interface controller, and it looks like we have some way to do that via either USB or Ethernet or a display touchscreen, right? So that's pretty important to understand. And so that's what we're going to focus on here before we get to the next thing. I'm actually going to show you a video that kind of shows you the dangers of connecting your user interface to your Ethernet jack or your communications module. So what this is doing is essentially driving from the network user interface button presses, right? So, and this is what the FDA saw when they actually issued their cybersecurity safety advisory for this particular pump. So they advised that this pump should basically not be used in hospitals anymore. So, but before we even got to this point in time, you could actually take a look at the 3 different architectures that are associated with these various pumps, and you could say, in all likelihood, the ones that are easiest to exploit had the least amount of hoops to jump through from the connectivity engine to the actual pumping mechanism, right? And I think that's something that's very important to understand. So, once we drive the user interface, we're actually driving it to what's called a biomed mode, which is kind of a service menu mode. And then we basically kind of initiate some functionality that's not supposed to be initiated, right? So that kind of leads us to another set of issues that we kind of deal with in the medical world as well, and that's something that's called intended use. But we'll get to that here towards the end. From current slide. If you want to play around with the communications module operating system, this is what it looks like. It's a BusyBox operating system. The way that it's communicating over serial is it's passing messages back and forth that essentially look like this. So sometimes it's a kind of an XML formatted message, which is pretty interesting. Sometimes it's a very simple message like this. This is like a heartbeat message that we see down there. That's being passed back and forth to kind of let the main pump board know that the communications module is still alive. So if we look at these 4 digits over there, does anyone know what that is? Right there, those 4 digits. That's a checksum. So when messages are getting passed back and forth between the communications module and the main board, there's actually a checksum that's appended to the messages. So the main board knows that the message that's traveling over serial hasn't been tampered or altered in any way, mangled as in transit. So, one of the things that we talked to the manufacturer about is the separation is really good, right? So in fact, that's exactly what you want when you design a pump like this or anything that's really sensitive. You usually want separation between your communications module and your main pump board. One of the things that we're really concerned with is that the communications module actually offers the pathway to do firmware updates, right? So that's a by design bridge to get from the communications module to the main pump board itself. So we showed the video that actually drove kind of user interaction to a screen. They can probably stop that, right, depending on the architecture of the pump. But for the firmware updates, the way that it's currently kind of configured, the communications module by design has the ability to send firmware updates to the actual main pump board itself. So that's something that we're always kind of worried about. There's some ways to kind of tap into the serial communications, which is interesting. You can actually man in the middle serial communications pretty easily. I use some software called Termite. I highly recommend it if you're trying to inspect any kind of serial data traveling over the wire. And I'll talk a little bit about deployment, then I gotta end here. So normally, this is the way you kind of do asset management with these infusion pumps. So you have pumps in various rooms for people who are sick, and what those pumps do is they actually send a heartbeat to a centralized station that says, hey, this is the way you centrally manage a lot of these devices. And this is the way that it does it. It sends this HTTP request. You'll notice that it also uses this CRC value here, the same CRC value or the same CRC algorithm that it uses for serial communications as well. So, and then the software itself will actually receive these kind of pings from the devices and update this chart here. So I have this software, I've been running it in kind of my own personal lab, and this is what it looks like. And so, there is no validation as far as what's coming through. So you can name your device whatever. This software really has no way of knowing that a real device is talking to it. It only knows that it received the right HTTP request, and it's going to populate that device data inside of the user interface in the database. So if we look closely at how I'm logged in as a user called Hospira admin. But if we look at the user list, there actually is no Hospira admin user, right? So, because that's actually a backdoor account that they put in there for service and technician purposes, right? So the password for that account's super difficult to guess. No one, I think, would ever in a million years ever guess that. So, and they also have various keys that they use for various things as well, right? So they have a lot of different passwords that they use for various things. Like these are all SQL Server accounts that all work at SA with the highest privileges. They have better passwords. They're not as easy to guess, but you don't really have to guess passwords when they're hard-coded into the software, so which those are. I'm going to speed up here and just kind of talk about one of the more dangerous things that we saw, just kind of from an architecture standpoint. If you're creating an IoT device, generally you don't want to do this. For the most part, when we look at IoT or medical or whatever, when we see where the device acts purely as a client, those are usually pretty challenging devices to hack, right? So, because the attack surface is very small. It's got no services listening, so really you're just trying to get access to the transport and then do something from there, or maybe spoof a server and try to convince the device that you're a server and tell it to do something like that. Usually what you don't want to do is put a server on the device itself. Right, and these devices all have servers on the devices themselves. In fact, that's the way they're designed to work. And so, whenever these devices have to do something, like a firmware update, like a drug library update, or a configuration update, or a command request, there is a server on this device waiting for someone to basically issue that request to the pump itself. And so, this creates all sorts of problems and makes it very, very difficult to fix because it's an architectural issue. This is what that looks like, a request to a pump. You basically post it to the right area, there's a CRC value, and then you just do an X forwarded for wherever the mednet address is. That's not even required for most requests. So the two things that are required are CRC value and the time. And the CRC value kind of encompasses the entire body of the payload that you're sending. So you can do configuration changes that way, drug library updates that way. So if you look at the CRCs, if you didn't know the algorithm, you could probably brute force it. It's very small. There's probably about 36 different combinations for a CRC of that length. But for the drug libraries, there's actually 2 different CRC values. So this CRC encompasses the entire body of the message, and then this CRC actually encompasses the entire body of the drug library. So if you actually don't know the CRC algorithm, it's actually going to be really difficult to forge a drug library request to the device, right? So, and then you provide a drug library name. The transaction ID is very important. As long as the transaction ID is higher than the last transaction ID that it's seen, the pump will actually accept your drug library update and process it. And this is what a drug library update looks like. You have a DN, which is a drug name. These DBCs are actually barcode numbers. So when we talked earlier about when you put your drug in, it scans the barcode, this is actually what it's comparing it against, the barcode specified in a drug library update. So generating CRCs, this is how you would generate the CRCs for the requests. Instead of you furiously typing or trying to make a copy of that, whatever, you can just go to this GitHub repository and download it yourself. So I wanted to have time for questions, but I think there's going to be drinks in 15 minutes. So, but okay, perfect, excellent. So we have about 5 more minutes for questions. I'd be happy to answer anything that you guys have. Always an honor to speak here. We always have really talented speakers at S4. Always an honor to speak in front of you guys. So thanks for having me. Appreciate it.
All right, I think we've got 5 minutes to grill Billy here and ask him how come he has so many pumps. And I can see a lineup building up right here. Marina, go for it.
What are the safety regulations to the design of these pumps?
Yeah, so that's a really good question. I had those slides in here. I took them out because I wanted to make sure that we were good on time. Right now, there's official guidance. Well, I won't say official, formal guidance for cybersecurity and medical devices, but there is no requirements. So, and the FDA hates when I say this. It's technically possible to sell a device that hasn't gone through a security review, but it's getting harder. So, it's a double-edged sword. So it is very different than the ICS community in that you have a centralized authority like the FDA, and I think the European market has a different one in order to sell a device. It's not a certification. It's a clearance process. And so the clearance process looks at the quality of the device. And so I've been involved with a couple of those. I've written the cybersecurity portion for a couple different devices. There is no requirement. It's a recommendation. So I would like to see some parts be a requirement. Generally, I'm against governments trying to get involved in things like this because they usually do a very poor job. But we have to remember that this is already a very highly regulated industry, and essentially the manufacturers in this industry, they will not do anything unless it's regulated for them to do. Because if they do things that they're not required to do, it may cause them to have certain liabilities that they would not normally have, and certain protections that they would not normally have. So hopefully we can do more. I think the biggest challenges now are not technical, they're political. Talking to folks in DC, I think everyone needs to know that things need to be done, but it's definitely hard to change a giant industry like this quickly. So, yeah.
I'm curious about the firmware update process for the pumps you've looked at. Are those signed? And then also Wi-Fi encryption and authentication, did those pumps use that?
So the firmware is not signed. The way that, there's a couple different ways to do firmware updates. So if you have the shell access, you can actually drop a file into a particular location, drop another file with a particular value in it, and it'll actually try to start a firmware update. For some of the pumps, when you try to do a firmware update, the technician actually has to be present at the actual device itself and enter in a technician code to start the firmware update process from the main board. That's a good design, I think. So, but at the end of the day, if your malicious firmware is on there and it's all going through the communications module, if that firmware is ever updated and there's no signing requirement, you could actually get your firmware in there as opposed to the technician firmware when the technician actually tries to do a firmware update, because it's really hard for them to validate that the firmware going on there is a firmware that they intended to, right? So the private key that we showed you, so once again, having a server on your device is generally a bad idea. I mean, there might be some circumstances where it's probably a good idea, but generally it's a bad idea. Those keys are actually for the communications protocols that are optional for that the server component. So you could opt into a TLS, essentially SSL, HTTPS, but the private keys are on the box, right? So you could maybe upload your own private key, but since you can just shell into there pretty easily, anyone can pull down your private key and decrypt the communication. So given that we have the private keys for all their certs, I think it would be pretty safe to say if you're depending on their encryption to protect your data in transit, that's probably not a good idea. Probably need another solution. Yeah.
Thanks. Any more questions? Okay.
I don't even mind if you guys drink and then play with the pumps. That's cool too. So they're all yours. Like I said, they're on the table out in the entryway. Don't be afraid to push at them. There's also a Wi-Fi SSID called MedNet. If you connect to that, you can actually get network access to the pumps as well. So don't be afraid of breaking them. I don't mind.
Can we use the pumps to get our dose of alcohol in?
You could definitely, I have one spike for an IV bag. If you want to do that, you can definitely do that. So.
Oh, we've got another questions.
One final question. Hey, Billy. So I know FDA has recommended one brand of like the Hospira pump that they just said not to use, but obviously there are many more that are out there that also probably have many of these problems by different manufacturers. So for that legacy install base, what is your advice to health centers, hospitals, in terms of how to isolate those on their network, monitor them, manage them?
That's a good question. When I say there's guidance for cybersecurity, that's for the clearance process. There's actually no post-market guidance right now, and the FDA is trying to work on that. I think they've actually already written it, but they're having troubles kind of getting it published. So the reason that that's important is because there is no requirement for manufacturers to do anything right now, right? And they won't. So if you find an issue in one of their pumps and that issue affects other pumps, there's no obligation for them to report that. In fact, they will not investigate that because they don't want to figure that out in some cases. There is also no obligation for them to identify what the impact is. So if you find a vulnerability and say, hey, I have these series of vulnerabilities, the manufacturer has no obligation to chain together those vulnerabilities and say, based on your report, it appears that you could hurt somebody. They don't have that obligation to do that in there. We call that variant analysis, is when you find all the things that are affected by a particular vulnerability. Microsoft does this for their products. Adobe does this for their products. You report a bug to them. It's not like you have to figure out every single version that's affected. They do that for you. And then the second piece is impact analysis. So they'll say, hey, Microsoft does this, Adobe does this, everyone does this. When they say, hey, this is actually a critical bug, there's no requirement to do that yet. So when we see a safety advisory, that means someone has literally demonstrated that you could hurt somebody. Not theoretical, not kind of guessing. They have literally demonstrated that you could hurt somebody. So that's something that we definitely need to keep in mind, because there's not that many medical device advisories out right now. And so for healthcare organizations to kind of get a good understanding of what their risk is, it's a little difficult. So.